as I said, ours was one of 5 projects which were supported under the TDR IDRC Research Initiative. At that time, the initiative was titled Population Health Vulnerabilities to Vector-Borne Diseases and Increasing Resilience under Climate Change Conditions. So for us, we worked with the Maasai people. And the disease of interest then for us was trypanosomiasis, in particular African trypanosomiasis, which affects both humans and cattle. Now, we picked trypanosomiasis as a model disease due to its complexity. This is a disease which is vector-borne, it is neglected, it is zoonotic, and yet it is neglected, although it is quite, let me say that it is endemic, at least in cattle now. The disease was very important in many countries in Africa and Tanzania in particular also during the 1970s up to 1990s. However, due to a number of research initiatives and national initiatives, somehow the disease got controlled. So we don't see much of the disease in humans, but vectors are still abundant and cattle still show the disease. So when it comes to populations, to people like the Maasai who live in interface areas, interface meaning areas where humans, livestock, and wildlife intermingle all the time. So these populations are at a big risk. So we thought it may be important to look at the dynamics of the parasites in vectors or in other hosts, just in case we can come up with strategies to stop future emergence of the disease in humans. And that was our whole purpose. So I'm showing you here a map of Tanzania, northern Tanzania, where we worked for 5 or 6 years, 2013 to 2017. But also I'm showing here quickly a review of our methodology that we worked hard with the Maasai people. It's important to understand their knowledge, their perceptions, their practices. How do they make themselves resilient in such conditions? So we set traps. We collected flies in order to look at parasites, density, parasite prevalence in the vectors, but also we sampled thousands and thousands of livestock in order to see that the parasite is transmitted to livestock, but is it also transmitted to humans? So that was the purpose, and we had a number of publications, which I don't want to go into because that's not the focus of this presentation. But then we had like 5 key findings from that project. Number one, we found that the Maasai people had very limited awareness of the disease in humans. They knew that the disease affects their cattle. And you can see from the data that we obtained then that only 34% of sampled Maasai people were able to recognize any symptoms of sleeping sickness, which is a terrible disease when it comes to humans. But they knew that the disease affects their cattle. Some of them knew that the disease is transmitted by flies, but most of them didn't think that the fly is responsible for transmitting the disease to humans. So awareness bringing, giving them knowledge, engaging with the communities was of utmost importance. Finding number 2, we were able to show that, or to confirm that fly abundance or vector abundance is definitely positively correlated with the type of vegetation. So the Maasai steppe where we worked has all types of vegetation, from riverine to sort of a dryish, etc., etc. So the more the vegetation, the more the vectors. And this was important to consider, especially when we're giving education to the people, that Maasai people, as you understand, I hope you know this, that they're mostly non-sedentary. They move with their livestock year-round, looking for pastures, looking for water. The livelihood of the Maasai people is completely intertwined with the health of their cattle. And such sedentary life somehow exposes them as well, not only their cattle, but also them to vectors. And flies being amongst the dangerous vectors. So we had to, to design ways or strategic approaches that could give them more knowledge how to shift their cattle in an intelligent way so as to avoid vectors. Finding number 3 was that in thousands and thousands of flies that we screened, when here we're talking about over 10,000 flies screened in our laboratories, we were able to detect a number of trypanosome parasites, vivax being the most abundant. However, fortunately, we couldn't confirm presence of human infective parasites at that time, which is the T. brucei. And therefore, we said, okay, in the meantime, the disease may not be a risk to humans, but at least the vectors are there and other intermediate hosts like cattle are also present. So we need to work further. Where do the parasites hide when not found in humans? Another aspect of the project was to address issues of climate. And since all our sampling was seasonal, dry season, wet season, intermediate seasons, we were able to show that seasonality was of big importance to the prevalence of the parasites. And therefore, when we advise farmers, when we advise the Maasai communities, we had to take climate into consideration. And we had a number of publications on that, I think one PhD and one master's just on seasonality and vectors, seasonality and parasites. And I would like to dwell on that. But then on this slide, I'm showing you how we did community engagement meetings with the Maasai people in order to translate our research findings to tangible solutions. It was very important to hear the voices of the local people. These people have lived with their cattle in the interface areas for hundreds of years. The understanding of health may be different in an academic manner as compared to the way the local people understand what health really is. So you need to listen to them to understand how do they consider themselves vulnerable? Do they consider themselves resilient? What adaptation strategies do they use in order to remain healthy in those conditions? So by talking to farmers, you come up with a number with a number of smart ideas that led us to development of what I can call like coping strategies that they use and that we think we can put some academic on to them so that these strategies can also be uh, developed further and also applied in a broader geographical area than the district where we worked. So some of the community adaptation strategies that we were able to come up with is number one uh, to consider that whatever the Maasai people know is important for them and their livestock, and that cannot be negated, that cannot be neglected. But number two, where we thought it was important to advise them to form the so-called eco-health partnerships so that the people can come up together, whether at the level of a village or at the level of several villages, so that they can come up with a means to prevent or to reduce the risk of the vectors and the risk of the diseases and so forth. And we had one PhD coming out of that as well. So I think I would like to spend more time on the older work. Now, I want to say that by 2018, that project ended. And one of the interesting things that we did is we were able to develop mapping tools that can be useful for decision making by the Maasai. So in partnership with our colleagues in Tanzania and outside Tanzania, we were able to develop a tool that allows the Maasai people, even in the most remote areas, to use their smartphones, because they also have smartphones, to to save, to know in advance where uh, flies are more abundant, where water points are found in which month of the year, where pastures are of less, well, with less vectors in which time of the year, etc., etc. And this smartphone app happened to be quite useful to not only to the communities, but we also took this further beyond the communities to a policy brief level. And you can see here in the bottom photo, whereby we presented our results to the Ministry of Health in Tanzania. And one of the good endpoints of this project was that trypanosomiasis was then considered as one of the so-called priority zoonotic diseases in Tanzania, based on not only our project, but also projects from maybe inputs from other researchers in the country. So this is a quick brief of what happened between 2013 and 2018. Then 2019, 2020, this was a period whereby, let me say, we had passive engagement with the communities. We had no funding, but then we retained contacts, because the farmers, the pastoralists, were very happy with the strategies that we discussed with them. They were very happy with the results feedback that we took to them. So they kept calling us and we kept visiting them. And one of the good things that happened then is I was also able to share these initial results to the JCB in Geneva sometime 2018, 2019, I guess. Yeah. So that project remained alive in the hearts of the Maasai people, although there was no funding.